Hi, my name is Tiffany and welcome to my presentation. Today I will be talking about myotonic dystrophy type 1. There is two types, but today we'll be focusing on type 1. This is one of my best friends. We started trouble way back in ninth grade. You may ask, why am I showing you her picture? At a young age, she was diagnosed with myotonic dystrophy type 1, also referred as Dm1. When we talk about Dm1, myo stands for muscle, tonic stands for spasm, dis stands for bad, and trophy refers to nourish. Dm1 is a multi-system disorder that always impacts the functioning of the smooth and skeletal muscles while also affecting the eye, the central nervous system, the endocrine system, and the heart. If you take a look at the pictures, you can see the muscles in her face are droopy. This is one of the signs of Dm1. Dm1 is carried on in an autosomal dominant pattern that often results from mutation of the Dm1 genes, which is important for normal movements of the muscle. Dm1 comes with symptoms ranging from muscular symptoms to non-muscular symptoms. My friend Dawn, symptoms include myotonia, which means the muscles aren't able to relax after they contract, daytime sleepiness, early cataracts, weakness in the hands and feet. Just recently, her disease started getting worse, so when she walks, it's almost like she's marching. Myotonia entails weakness and wasting of voluntary muscles in the face, legs, neck, and lower arms, especially when stressed or during cold temperatures. It also may cause difficulty in chewing and speech due to the impact of the tongue and jaw, and pain commonly in the legs alongside fatigue and stiffness. This is something that she does struggle with. Oftentimes we won't be able to understand what she's saying, and we often have to ask her to repeat what she's saying. Dysphagia, which means difficulty swallowing, wasting and weakening of the skeletal muscles between the diaphragm and the rib muscles are also common in Dm1 patients. Cardiac arrhythmia can also be experienced as the heart system fails to set the rhythm and rate of the heartbeat. The smooth and involuntary muscles surrounding the internal organs cease to function, resulting in constipation, diarrhea, bloating, and colicky abdomen pain. Radial cataracts are sometimes experienced, causing the patient's visions to be dim and blurry, and within time it gradually worsens. Cognitive dysfunction causes abnormalities in the brain that controls the rhythm of waking and sleeping, resulting in excessive daytime sleepiness. Myotonic dystrophy type 1 results from mutation within the gene on the long arm of chromosome 19 called the Dm1 gene. It is likely to produce a protein that ensures effective communication within its cells. Dm1 is caused by the trinucleotides repeat, the multi-repetitions of group of 3 DNA nucleotides in a row. The repeated nucleotides are thymine, cytosine, and guanine, and the only one affected genes is necessary for the inheritance of the disorder from the parents to the child. A 50% passing down the gene causes the disorder from parents to child because of an autosomal dominant pattern. Unfortunately, my friend didn't get it from her mother. So the basic demographics and frequency of the Dm1, it can develop at any age from birth to during childhood and to adulthood. You could see here the age of onset for Dm1 can be at any age, as in Dm2 is usually profound in adulthood. The gene for Dm1 that's affected is the Dm1 and the Dm2 is CNBP. This disease is rather common, as in 1 out of 2,300 people is affected by the disease internationally. And in the United States, it is recorded approximately 140,000 individuals affected by this disorder. The data might be significantly underreported. The disease is set to happen from birth to old age and therefore considered onset. The condition severity varies broadly among the affected individuals, even among members of the same family. My friend Dawn, she has it. Her sister, she has a twin. Her twin has it, and her youngest sister has it really bad, and the mom has it really bad. Symptoms can be seen at any age, but more so during the individual's 30s and 20s. Let's talk about causes. In DM1 patients, the repeat of the CUG is expanded with the DMPK mRNA. DM1 cells lack the free protein that affects the processing of the RNA. This gene will end up repeating, making it a longer messenger RNA that results in problems with other various proteins, this stopping the muscle functioning normally. DM1 is inherited in an autosomal dominant pattern, meaning it requires only one copy of the defective allele, one copy with the abnormal expansion to result in the disease's symptoms. Every child of a parent with this disorder has a 50% likelihood of inheriting the gene flaw that results in the disease. The child is almost certain to develop the disease if the DMPK genetic abnormality is passed on. Dawn inherited this disorder from her mother, who often experienced milder symptoms than her mom. Her mom is currently in a wheelchair and unable to eat, so she has a feeding tube now. Diagnosis and management. DM1 results from the expansion of the CTG trinucleotide repeat with the non-coding area of DMPK. A length of CTG repeat that exceeds 34 repeats is considered abnormal. The doctor can complete a medical history and perform a physical exam. The doctor might settle on ordering a full enzyme test to expose the elevated enzymes from damaged muscles. Because the damaged muscles release creatine kinase enzyme. Genetic testing performed might help in examining the blood for potential mutations. Prenatal testing and pre-implantation genetic testing are possible if an expanded DMPK allele is recognized in an affected member of the family. More testing, such as muscle biopsy, the removal of a small piece of the muscle, can be examined to identify different types of muscular dystrophies. The heart monitoring test is efficient in checking the heart muscles and the function. By electromyography, a needle electrode is inserted into the muscle of the affected adult, presenting data of myotonic discharges and myopathic evident motor parts predominantly within the distal muscles. Changes in the pattern of electroactivities a certain muscle disease. There is also a mild elevation of serum CK concentration in people with DM1, with weakness and more so in the asymptomatic people. Management can be challenging. Using wheelchairs, ankle and foot orthos can also help with mobility. Pain management, cataract removal, and hormone replacement by therapy are also crucial. Cholesterol-lowering treatment while practicing physical activities and managing needed weight is crucial in preventing secondary complications caused by the disease. Evaluation of relatives at risk and surveillance, such as ophthalmology examination, is essential for managing the disorder. Unfortunately, there is no cure for any form of DM1. However, some people have resolved to use medications such as steroids, which have been recorded to delay the progression. Other individuals have opted to use physical therapy and occupational therapy to help keep the muscles, both of which have proven to work out in favor of the individuals, though with some various effects in the individual's body.